How effective would you say TMS is for treating depression?
I would say very effective. I mean, I have been so excited with the outcomes. So, I quickly tell people, at least twice as effective as medications. I mean, our site, we track
Ah,
responsive and yeah, we track response and remission rates. And so we have a 75% response rate and a 54% remission rate, which is really good, right?
yes.
In the typical literature, it might be like 30 to 50 for
Hmm.
remission and maybe 50 to 60 for response. Yeah, I think it's because we do a lot of those other things too, to augment the response.
Yes. So,
Um,
but it's so important, right?
yeah, yeah, yeah. But
I
at least
like that.
effective as medication, I think is a fine way to say it without the side effects, which is great. I mean, I'll tell you something. This is another, well, just interrupt me if you want to ask your other
You
question.
go ahead.
When I opened TMS and I was like the first person in Southern California, I'm like, oh, like I don't,
2009, correct?
yeah, 2009. And
Yeah.
so private, first person. And I had my private practice going on and I'd been doing, psychoanalysis, psychotherapy, pharmacology for 10, 15 years.
Hmm.
And, you think your people are good, right? I mean, they're good, like they're better, right? And so I wasn't really offering it to any of my patients, right? And so time goes on, I have the little flyer in my waiting room, and my patients start coming in and they're like, well, can I do TMS? And I'm like, well, you're good, right? And they're like, well,
Yeah.
I'm better, but I'm like, I'm not like my real, like, I'm not 100% better, which is you lose perspective, right? Like, I met
Yeah.
them much better than when I met them. But that to me is the difference of TMS. And then those people went into
Yes.
TMS and the way you pop, and I don't know how other way to say it, but pop, like the clarity of mind and the feeling, it's just, you have to sort of do it to like,
Yes,
oh, right?
you do. Uh,
It's different better.
yeah. No,
That's the
100%.
better.
I
Yeah.
know. I know.
Yeah.
I know. I was
Yeah.
afraid to do TMS I looked at TMS for 3 years.
Wow.
Had TMS chairs, treating people with TMS be-
Kyle.
before I was willing to get in the chair myself. Unfortunate accident happens in my life that left me broken and just a shell of a man. And I knew I couldn't live like that, which
Yeah.
being that I had TMS chairs, thankfully I knew the right people to call to get in a chair.
Awesome.
And
Yeah.
here I am today, just a better man, all around. And like you said, pop, right?
Yeah.
There's no difference. A lot of times I hear people say TMS TMS made me the old me, or I hope TMS will take me back to the me that I was once upon a time. And I'm like,
You don't
you're
want that,
shooting
right?
you're
You
shooting at
want
the
the new
wrong
me.
you're shooting at the wrong goal here. Let's just
New
make
and
you
better
better than you've
version.
ever been. Because that's what TMS did for me.
Yeah, that's a
You
great
know,
way to say it. How come you were so fearful of doing it?
it messing with my brain.
Yeah. Yeah. Well, like I say, that's the most common thing I hear. I mean, our brain's an important organ,
And that's
right?
honestly, that is why I talk TMS. That is what started it. And like I said, I was treating people,
Yeah.
not
Yeah.
we were treating people.
Yeah.
And
Yeah.
there was no way I was getting in a chair. There was no way, right? I knew the benefits.
Yeah.
I knew the benefits of it. I watched the benefits of it. Wasn't going to do it until it was too late that I
Painful.
had no other choice. And that's one of the biggest messages that I want to get out there is don't wait until it's too late, until you have to do it. There's
Absolutely.
no point. Do it now.
Yeah.
You can receive this treatment now,
Yeah,
right?
that is a great message. And yeah, I mean, it is scary for patients. Like the best, some of the best ways that I've helped people come in is we let them talk to other patients, right? Because
Right.
I think that helps too, right? Of course, I hope they trust me and they believe me, and or they can read other stuff on the internet.
Uh-huh.
It's just about like our services. Now there's a lot out there, your show. But there's nothing more than sometimes just another patient to say, yeah, like I did it. I was really afraid too, right? And it was
Right.
the best thing that I did. And it really helps them feel comfortable, and feel like, yeah, really cared for versus marketed or.
Hey guys, I know you like that video. Do yourself a favor. Click on this one right here. more content about TMS, the benefits of TMS, and how we're going to change the world with TMS. Did you click on it? Click on that one right there.